is formed from tissue or cells growing over a lobule in the breast to form a solid lump. Now, there are different types of fibroadenoma. You may have a simple one where the size is about the size of a pea or between 1 to 3 centimeters, or a giant fibroadenoma that grows to more than 5 centimeters, and that type is common in pregnancy or when breastfeeding. If the fibroadenoma happens in teenage girls, we call it a juvenile fibroadenoma. But if you have more than one, then you're said to have a multiple fibroadenoma. Lastly, some women have something called a complex fibroadenoma that is different from the other 4 I've just mentioned. When you look at it under a microscope, some of its cells look different to each other. Now, having a fibroadenoma does not usually increase your risk of breast cancer, but the complex type may slightly increase the risk of developing breast cancer in future. So, if it's a fibroadenoma, after diagnosis with a scan or mammogram, you may need a biopsy, especially if you're over the age of 25. A biopsy involves taking small samples of the lump and looking at them under the microscope. Most fibroadenomas don't need treatment. You'll be asked to keep an eye on it to check if it's growing, to keep examining your breasts, and return to your GP if anything new develops. Surgery might be considered for complex, giant, or even juvenile fibroadenomas. It could be under general or local anesthesia. Essentially, most fibroadenomas will stay the same size. Some get smaller and eventually disappear with time, but some can get bigger, like we've said, and this is more common in teenage girls during pregnancy, breastfeeding, or in a woman who's taking HRT. Number 3, PASH. The next cause of a lump which is benign in the breast is something called PASH. PASH means pseudo angiomatous stromal hyperplasia. And if you break all that down, it simply refers to an abnormal growth of the connective tissue around the breast. It's a common cause of a painless lump that develops in women commonly before menopause, though it can happen at any age. It's also thought to be related to hormone balance or imbalance issues. Now, the size of the lump itself can vary from one person to the other, but the diagnosis for this condition is often pretty clear after you've had a mammogram, a scan, and biopsy. PASH doesn't require any treatment. Often you'll be asked to monitor the lump and come back to see your doctor if you notice any changes. Number 4, let's talk about fat necrosis and lipoma.